Could you tell us your name, organization, and position?
My name is Worthington. I work as the AIDS Portal Manager to manage the AIDS Portal.
Okay. And how do you think HDN and the AIDS Portal complement each other?
I think there's a lot of complementarity actually. It's something I'm very excited about. We're both working at the country level to support partners. We're both looking at making the linkages between what's happening at the country and what's happening globally and how there can be greater voice and interaction. But I think there's a nice fit in that HDN's focus is much more on the dialogue and the documentation, whereas AIDS Portal is much more on the networking and the evidence side of that.
Okay. And how specifically can this partnership assist in advancing the response to HIV and AIDS?
I think one of the things we've always felt is that there are so many organisations responding to HIV and AIDS right now, and there's an awful amount of money. Not to say that more isn't needed, but what is really needed is people that are focused on how to make the systems that are there, or not there in some cases, work more effectively and more efficiently. And I think that's what these two organisations can bring to bear.
Okay. And what is the overall value of partnerships, as far as you can see?
Well, I work for a network, so I guess I must be fairly convinced of the value of partnerships, although I'm amazed always to meet people that aren't. I think there's always more power in working together. You need to bring different strengths to bear, but you can learn from each other. It has to be the way to do things.
And what is the most interesting or useful thing that you've learned this week?
It's a very good question. Wow. I think just learning who's doing what within HDN, how it all fits together, where it's going. It's very helpful to get that inside experience of the organisation.
Okay. And how does HIV/AIDS information management contribute to the response to HIV?
A lot of different ways. I mean, starting with the very basics, just information for people to be able to educate themselves and have better health-seeking behaviour. Professional development, advocacy, campaigning, better programs and interventions, they're all things which come from better information.
Okay. And what are the next steps? What does the future hold for this partnership, as far as you can see?
I think a greater number of partnerships at the country level and more coordinated and strategic activities to serve those partnerships between HDN and AIDS Portal.
Okay, great. Thank you so much for your time.
Thanks.
I really appreciate it.
Thank you. Thank you, Rob.
Easy, huh?